We offer the full gamut of pain management techniques, from drugs by mouth, physical therapy, chiropractic care, surgery, and injections. And we don't just offer epidural injections, we offer facet injections, we offer radiofrequency ablation where we burn the nerves to the facets. We offer implantable pain management techniques like pain pumps and stimulators. We offer intercostal nerve blockades for shingles and broken ribs. We inject shoulders, knees, hips. We have steroid injections for the shoulder, knee, and hip. We also do Synvisc injection, which is artificial joint fluid. We diagnose and treat headache. We manage headache with sometimes nerve blocks to the greater and lesser occipital nerves, and sometimes we freeze those nerves with a technique called cryoablation. I don't believe there's any other clinics in the area offering the cryoablation treatment that can also be used for phantom limb pain. I'm dual certified in physical medicine and rehabilitation by the allopathic and osteopathic boards, which is really kind of a rare situation. It makes me quadruple board certified, and as far as I know, I'm the only quadruple board certified pain management physician in mid-Missouri. I'm also a member of the American Osteopathic College of Physical Medicine and Rehabilitation. And being a member of that college is sort of a privilege in and of itself. However, for certain members who have gone out of their way to serve the college, lecturing at national meetings, writing board questions, proctoring board exams, they offer a special track called fellowship in the college. And just a couple of months ago in Philadelphia, I received a fellowship award from the American Osteopathic College of Physical Medicine and Rehabilitation. That was a real special moment in my career. One of the ways to really rescue someone out of that pain when they've had 2 or 3 back surgeries and no further surgery is indicated is implantable pain management techniques, primarily spinal cord stimulation. And we've had excellent results with spinal cord stimulators. This is a technology that's been around for about 50 years. 2017 will be the 50th year anniversary for spinal cord stimulation. What happens, it's almost like a pacemaker for pain. We stimulate nerves on the back part of the spinal cord that block the pain signal from getting to the brain. It's a very useful technique for folks who have had back surgery and persistent pain, and then also folks with diabetic peripheral neuropathy, which is an extremely difficult condition to treat, and then folks with phantom limb pain can also benefit from spinal cord stimulators. I would say give us a try. I mean, the way we do the injections is a little bit different based on my particular training than most of the other doctors around. For instance, we use local anesthetic in the epidural space and see great results with that. We've got all the treatment modalities that I've talked about in some of the earlier questions to bring to bear on the situation. We have an excellent staff that is a dedicated staff just managing patients in chronic pain. Recently, the Centers for Disease Control and Prevention released a landmark guidelines that really suggest there's no evidence in the medical literature to support the use of opiate medications in the treatment of chronic pain. If you think about that for a minute, it's like, well, you might as well shut down the production of OxyContin because we don't need that anymore. There's no evidence in the medical literature to support the use of opiate medications in managing pain that lasts for more than 3 months. So what are we going to do with all these patients that are suffering? Well, that's where the Boone Hospital Pain Management Clinic really excels. Physical therapy, chiropractic care, surgery, all these injections and procedures that we can bring to bear on the subject. Going forward, many family doctors are going to be extremely hesitant to prescribe these medications. Given my certain certifications and qualifications, we can do that in a structured, regulated fashion. So for patients that find themselves without any recourse, they can come see us and we can move forward in a responsible fashion. When folks have shingles, they get horrible pain under the ribs. When folks break a rib, obviously, there's quite a bit of pain involved with that. You used to hear about, people getting rib taped and things like that. They don't do that anymore. So one of the ways we manage pain is we block the nerves that live underneath the ribs. We use X-ray to do this. It's called an intercostal nerve block. Another common condition that you might not associate with the pain clinic per se is vertebral compression fracture from osteoporosis or cancer. And we're able to, under X-ray, guide needles into the vertebral body, and we think that micro-motion at the fracture site results in the pain. We're able to inject bone cement in a safe, controlled manner into this fracture, and it serves as an internal cast. And we've seen patient after patient after patient leave so satisfied after this particular kyphoplasty procedure. Spinal cord stimulators, we kind of touched on in an earlier question, but that's something you might not think of if you haven't been exposed to pain management or just suffering with pain over time. That's a mechanism whereby we can install almost like a pacemaker for pain to mask the pain out. Then there's also pain pumps. These are pumps that go into the spinal canal itself and deliver a small amount of medicine right where it's needed. For folks who have had abdominal surgery or hernia surgery and they've got groin pain or abdominal pain, there's nerves that we can block to help with that type of pain. And then for folks who have pain in the lower back and buttock area, sacroiliac joint injections is something you might not associate with the pain clinic, but we've had excellent results following those particular injections. You know, that series of 3 injections is really a myth. There's no evidence in the medical literature to support a series of 3 injections or a series of 1,000 injections. What it comes down to is minimizing the patient's risk every time you give them the steroid. There's very few conditions in medicine that really have a cure. And arthritis of the back, degenerative disc disease, facet arthritis, it's really just arthritis of the back. If someone has a low thyroid, the treatment is take a thyroid pill every day. If someone has diabetes, the treatment is give yourself an insulin shot 3 times a day. If I've been taking a thyroid pill every day for 8 weeks and I go to my doctor and say, hey, look, man, I've been taking this thyroid pill every day for 8 weeks. How many more pills do I have to swallow before it fixes my thyroid? He's going to say, look, it's 2016. I didn't fly here in a jet car. We can't fix your thyroid. Same thing for diabetes. I've been giving myself an insulin shot 3 times a day for 6 months. How many more shots do I have to take before it fixes my pancreas? It's never going to fix your pancreas. We can't do that. We don't have that capability in 2016. And the case is that most diseases in medicine, like 96%, don't have a cure. We manage these diseases. And so if a patient comes in 4 times a year for a lumbar epidural steroid injection, and it allows them to function at a higher level in less pain, to do more, to be more comfortable, to be able to improve their activities of daily living, that is a successful way to manage pain over time. We offer comprehensive pain management services. We have magnet nurses, which means they're some of the best nurses in the country. This is a dedicated pain management staff. We provide follow-up care. If someone gets home and has trouble 5 days later, they can call up, we'll bring them back in. And we focus on excellent care, striving for safety and high-quality outcomes. Well, you can visit with your family doctor and get a referral. Another way is to simply call the clinic for some more information at 573-815-2700, or you can search online at boone.org. When you get there, you can search under Pain Management Services.